Another very important part of your life is going to be wearing a mask. I'm afraid this is going to be part of your accessory in future. Whether you like it or not, you have to wear it when you go out hereafter when the lockdown is going to be eased up. There are a lot of myths going around about different types of masks. Let me explain to you clearly what this mask does and what are the types of masks we have. Basically, what you are looking at the mask is to prevent the droplet coming into you, as well as you don't give any droplet to others. That is what it means. But there are different types of masks. For example, this is what is called an N95 mask, which is used in the medical community who are dealing with high-risk patients. For example, somebody is treating a suspected COVID-19 patient or actually treating a COVID-19 patient. Because this is an airtight mask which a doctor wears so that he doesn't get any infection from the infected patients. But this is very expensive and it's not easily available. So please don't buy it at an expensive rate, because not only you're wasting your money, but you're preventing the medical community buying this. So this is not for people at large. Secondly, this is what is called a surgical mask. Again, this is predominantly used by doctors. This is what's called a 3-layer mask, which prevents a lot of virus coming into the nose area for the medical community, like doctors, community workers and nurses, etc. Again, people usually in the public, they need not use this. Not only is this expensive, this is disposable, so people cannot wear it in a day-to-day basis on the long term. Mind you, you're not going to wear it for 1 or 2 days. We are looking at a minimum of 6 months to 9 months now, because until the vaccine is found, discovered, or proper treatment is coming out, we have to follow these procedures very carefully. Right, what are the other things what we normally going to recommend for public? This is a reusable cloth mask. I think this is the best and cheap for everybody to buy and use. Basically what it's going to use is what is called hygiene. It's what the face hygiene. Whenever you talk, basically your saliva doesn't come out, or accidentally when you sneeze or cough, all the droplet doesn't go out. Not that you are infected, in case you are carrying a virus, it doesn't go into the community. That is what this mask is going to go about. I'm afraid this is going to be very imperative. In fact, government has got regulations now. If you don't wear it, you'll be penalized. I think you can be fined up to 100 rupees if you don't wear it. And that is what this mask is going to wear. In fact, now there are a lot of companies who are coming up with the fancy ones so that you can buy whichever suits you, reuse it, and not only you're protecting yourself, you're protecting the community. My dear friends, life is not going to be easy anymore. We know that we've been locked up in the house for 2 months and we're going to be let out. But when you go out, it is not going to be the same. This is what is called new norm in life. Wherever we go out, we have to take precautions and we also have to protect others. For example, vulnerable people in the family or in the community, we have to protect them. So we have to follow all the regulations, what the medical community says, what the government says. Only then we can prevent the rapid spread of infection. Now that we are going to go to work, it may be a factory, it may be an office, or children going to educational institutions. Wherever you go to, please follow these norms very strictly. For example, when you are going to industry, if it is going to be crowded, you have to be screened before you enter it, so that people by mistake with fever or infection cannot get into this closed space and then infect others. In your office, for example, when you're having lunch, make sure you take this proper social distancing. People don't sit together and then transmit infections. Because when you're eating, you cannot wear a mask, mind you. So that is very common place where infection can get transmitted. Again, please do not touch any surfaces which can be potentially infected. Whenever you are coming to contact with the surfaces, you follow hand hygiene, either by washing with sanitizers, with alcohol, or with soap. Preferably, if you have access to soap, you wash with soap, hand up to elbow and the face. My dear friends, when you go out, stay alert so that you can be very safe without infection.